back to Rehab Renegade. One of the most common issues that we ran into this week was shoulder pain, and for the most part, a lot of the people we're seeing understand that foam rolling and stretching is important. A lot of them actually tried stretching or foam rolling and didn't quite think that it worked, but sometimes we're just missing a strategy behind what we're doing or a clarity or understanding as to why we're foam rolling. So what you need to understand is that we have a lot of different muscles that connect to the arm and that impact this shoulder joint. So one, taking care of the muscles, whether that's through massage or cupping or dry needling or stretching or whatever it is important because we want to actually take care of some of the trigger point formation that occurs in these muscles. A lot of times these trigger points are hyper irritable nodules in the muscle that can actually cause referred pain when they develop. Okay, the other thing we want to do is we want to try to lengthen or restore the quality of these tissues to actually get the motion that we're looking for. What you'll see is that certain muscles have a connection. So one of the most common connections is a connection between the lat, the pec, the bicep. You can see here that as you go and raise the arm overhead, they actually have an influence on one another. So as they become tight coming overhead, that can actually restrict the arm's ability to get overhead. And I'll bring that in a little bit closer so that you can see it. Right, we have the pec here coming across, we have the bicep, we have the lat. So as we go and raise the arm overhead, these become taut, right? A lot of times we're spending time in flexed postures, whether we're seated, standing for a long time, we become hunched over. So these tissues can become kind of short, right? The lat, as you kind of hunch over, that can become into like a stiffened muscle as well. And the bicep throughout the day can also become stiffened. So as we raise up, they become tight, they restrict motion. So we need to spend time going through and rolling the muscles in the back, stretching the muscles in the back. We need to take time and roll the muscles in the chest, in the bicep. These will all allow us to get into a better overhead position. If you've tried this stuff and it hasn't worked, please go see a medical provider that can maybe get in there and do, I'm not gonna say a better job than you, but maybe just a little bit more of a specific fine-tuned job than you're currently doing. The other issue that we also run into is knee pain. All right, so now we're looking at the knee joint. This is another common issue that we're seeing. People are often blaming arthritis or old meniscus issues, but what you have to realize is that the quad is coming down the leg, also crossing the knee joint. So as you go into bending motions, right at the knee joint, so a little combination of hip flexion, knee bending, especially maybe when you're running or squatting, what you can get is a lot of compression on the front of the knee joint through the patella. So we can get a lot of different reasons for knee pain here, but a lot of it is compression, right? So we need to go through and make sure we're stretching the quad. We need to make sure we're rolling the quad, doing soft tissue work here to treat any trigger points that could be causing referred knee pain, and we also need to treat the muscle to make sure we're reducing the compression here. So please don't use the meniscus or the arthritis as the scapegoat. Take care of some of these tissues. If you need some help, reach out to a qualified medical provider and help them get you to the next step.